Good evening. Christy Batterson, and I'm the Housing and Community Development Manager for the City of Edmond. I'm also the staff liaison for this project. On behalf of Chief Younger and I, we'd like to present what we're going to be doing, what we have done, and what we're going to be doing if you approve on this next phase. Just a little background. Back in 2021, several community organizations approached city staff along with the Edmond Police Department to engage a Healthy Minds Policy Initiative. This was a strategic goal of City Council at the time. We did a mental health assessment over a period of a year. We presented those findings in September of 2022, and the assessment found 23 recommendable action items. If you remember, back in January, we came forward with phase 3 of this program to begin implementation of the findings. So 3 key findings of this is that access to behavioral health services has multiple barriers for those residents that live in Edmond. Most of all is the cost and transportation cost and the lack of providers here in Edmond. The children and youth are the most vulnerable for these behavioral conditions, and there's a large stigma against those that have or are seeking behavioral health care. Healthy Minds identified critical needs, including work to be done for prevention of crisis, reducing unnecessary use of emergency rooms and/or public safety resources, and helping connect with care throughout the city. So just a little bit what we've done this past year. We've launched 5 teams. We have a steering committee that is composed of the mayor, city manager, both fire and police chief, EEDA, and the chamber, as well as North Care and Edmond Public School System. Healthy Minds is the plan facilitator and helps with all our steering committee and subcommittee meetings. We have 4 subcommittee committees. The CCBHC, which is the Certified Community Behavioral Health Clinic, that is North Care, will be our new facilitator of that. They have an implementation subcommittee. We have a school-based mental health subcommittee. We have a communications subcommittee, as well as a crisis continuum subcommittee that is composed of Edmond Police Department, Fire Department, 988, dispatch, and here to come probably in North Care, and here to include the emergencies room here shortly. We have done several things. Work in the mental health is never done. It's never completed. So what we have accomplished this past year is 988 launched their new system over a year ago, and we have coordinated an effort between our dispatchers and 988 to do what we call a warm transfer. So instead of taking resources away from our dispatch system, we can have what we call a backdoor number that we call 988 and hand that call over to those individuals, those case managers in the time of crisis or non-life-threatening situations where they can dispatch services or referral as needed. Opening of the North Care CCBHC outpatient clinic at 9th and Bryant. Hopefully at the beginning of this next year, within the first quarter, their urgent recovery center will be opening at Kelly and 15th. They are in the final stages of that construction. And then fundraising, again, for the urgent recovery clinic and crisis center that will serve youth families and adults at 15th and Kelly. Additionally, we've helped support development and fundraising for the Edmond Clubhouse Oasis, a location offering peer support of those individuals that are suffering from mental health illness. We've worked on a mental health campaign development and kickoff with workforce. The chambers held a luncheon at the end of November, and we had a panel of those that work in the behavioral health industry that was very well received. We've developed and written Healthy Minds has helped develop a written multi-year tiered plan for the school-based mental health. And as you also know, we've had case managers from North Care and each of the lateral systems of Edmond Public Schools to work with our SROs over the last year. community communication campaign, website procurement, and I'd like to give a big shout out to the City of Edmond's marketing team. Flourish is our new brand for this system because it's just not City of Edmond's plan and implementation. It is a community-wide effort. So we're hoping to launch in the first quarter a website that people will be able to go and various resources, both mental health, well-being, anything that they need. This would be their platform to start the process. So our proposal for 2024, like I said, our work is never done. Phase 4 will build on our growing capacity and momentum in Edmond, guiding and supporting local leaders and partners. We'll be going after several grants with the help of North Care and other community partners such as Edmond Family Counseling, and with Healthy Minds help in doing that. Supportive implementation, and then finally an evaluation and a report of outcomes. Again, this is not just a City of Edmond effort. This has been staff time internally as well as several partners from the outside. I'd like to give special thanks to individuals on our crisis subcommittee. We meet every other week to try to get our partnership started with 988. We visited the 988 call center. They did work on their own training. So I'd like to give a shout out to Jamie Inglett and Susie Wyckoff, as well as Major A.C. Hopper, Assistant Chief Brian Davis, Deputy Chief Chad Weaver, as well as staff Julia Reed from North Care, and then Tony from Solera, which is 988. They've, like I said, every other week we meet to try to move our plan forward. Shout out to EEDA, as well as the Chamber, and of course our major partner of North Care, has been vital in moving this plan forward. There's other partners from the Department of Mental Health and Substance Abuse, OASIS, NAMI, the list goes on, but I would like to thank on behalf of everybody here at the city of our partners, and I'm here to answer any questions as well as other staff members and Healthy Minds.
Council? I would just like to say thank you for everyone, Healthy Minds, North Care, the staff, all of our partners that as you said, this is just not about Edmond. It's about the region, that we know that there's a healthcare issue concerns there, and that we're looking to expand the services and out to everyone as much as possible. I just wanted to say thank you for all the hard work that's been going on, and all the hard work that still has to be done, because it's a continual effort that we must do.
Well, just to commend you, I mean, mental health awareness, there's a crisis going on right now with mental health. And it's a serious thing. And, you know, people don't think about it happening and about it affecting other systems except for just that person and maybe hospitals. But they do. They take up hospital beds there when they shouldn't be in a hospital. They need to be somewhere with counseling. Or they could end up having to go to the jail. And that's not a place for somebody who's suffering with a mental health crisis. So this is super exciting. Our community needs it. I'm just so thrilled about all of the partnerships that have gone in with this and how serious everyone's taken it. And meeting every other week is tough, but you guys have made the commitment, and our community will reap the rewards. And I just want to just say thank you to everyone involved in this.
Thank you for all the work that's been done by so many partners. One of the things that struck me when I was able to go over to the municipal court, which I hadn't been there before for my orientation, was the number of juveniles that we have through the docket, and then that ultimately, and I might be getting some of this wrong, get as part of their sentencing, have a caseworker that's assigned to them. I know there's a mental health component there. I do know in our current chambers, there's there's a lack of space. As we think about having a new courtroom, as part of the work that'll be done in 2024, bringing the juvenile court side into it, because I'd love to spend $1 today to save 10 tomorrow and have an impact on that family tree with some earlier intervention. Are they involved in it? And then do we have any plans to make any recommendations with that new space?
That's a great question. So Edmond Family Counseling is the one that handles most of the juvenile court cases or helps with that counseling as well as in the public school system. I have brought it up, and I know Chief Younger and I have talked about how to bring court in and involve Edmond Family Counseling as well as the court system of what we can do for diversion training, as well as, getting them, established with counseling at North Care and or other, mental health organizations that we have in Edmond. That's part of what North Care will be doing, is establishing those relationships. But Edmond Family Counseling has been key as well. They're on the CCBH steering subcommittee, and so they've been involved, and that's probably our next step on the crisis subcommittee as we work through the next phases of that.
That's great to hear. I'd love to see, as we have this new space, to try to envision, does that allow us for additional staff person with some expertise focused on our juvenile cases and docket? Does that allow us to have somebody from the Edmond Public Schools who can office there certain times during the week when things are going on, since all of those and the families tend to touch each of our systems. And so appreciate any collaboration that can be done, and would love to know of any budget items that we could potentially support in order to execute on that as we get that space developed.
Absolutely.
Sorry, just one comment on that, as we are expanding our municipal court, part of the city center complex, there is additional designated space for exactly what you just brought up right there. So in working with our court administrator, who unfortunately we have seen the needs grow for our youth, and so we did have at one point one dedicated staff to assisting the youth of Edmond in our juvenile court process. We now have 3. In addition to those additional employees we have added dedicated space for someone, be it from North Care or some other provider, to have an office space in there, not necessarily dedicated just to them, but to any other healthcare provider. So,
Thank you.
Thank you.
Thank you.
Council, any other questions?